Okay, folks, it's 3 p.m., so let's get started. Welcome, everyone, to the Building Trust and Partnership Through Peer Support session. So my name is Sayan Karunagode. I am joined by my colleague, Katie Peterson here, and we will be your moderators for this session. Before we get started, I just want to go over some quick housekeeping, and then I will introduce our speakers, and we will begin this great session. So first things first, I would like to draw your attention to the bottom of the screen. You can use the chat feature to submit questions. I will ask folks to wait till the end of the session to submit questions. And when you do, please type question in all caps and then put your question in front of it. And therefore, then we can find the questions a lot easier. And you're also welcome to unmute yourself and ask these presenters if you have any questions. But again, please wait till the end of the session. And also, I would also like to remind that I would like your microphone to be on mute throughout the session until the very end again, so that we have minimal disruption. Please note that this session will be recorded and it will be uploaded to the conference website. So you will have access to the platform for 90 days and you can access the recording then. We kindly ask you to complete a short evaluation after the session. You can find the evaluation on the platform on the page that you access the Zoom link. And these evaluations are very, very helpful for us. And then lastly, we respectfully ask all of those who are attending today's session to engage with each other thoughtfully and always consider the impact of your words and think about the interaction that you are going to have with everybody else here, as well as the speakers here. As moderators, we will not tolerate any sort of abusive or inappropriate behavior, and we will ensure that anyone who engages in such behavior will be removed from this session. So without further ado, I'll just introduce our lovely speakers here. So we have Rachel Venivri from McMaster University. We also have Misty Taylor and Mary Ellen Radell from CMHA Hamilton joining us and to provide you with this great session. Over to you, folks.
Hi, and good afternoon, and welcome, everyone. Thank you for joining us. So as you all know, my name is Rachel Venivri, and I'm a PhD candidate in the Department of Health, Aging, and Society at McMaster University. I have the pleasure of co-presenting with Misty Taylor, who is a peer support worker at CMHA Hamilton, and Mary Ellen Ruddle, who is the Director of Mental Health Court Support and Peer Support Services at CMHA Hamilton. And we are very excited to be here with you today to talk about building trust in partnership through peer support, and for the opportunity to share our results from our research study conducted in partnership with McMaster's Community Research Platform and CMHA Hamilton. So today I'm joining you from 6 nations of the Grand River Territory, and Mary Ellen and Misty are joining us from the city of Hamilton. For our agenda, we will open our presentation with a few questions. We'll then define peer support in the context of our setting, followed by a brief overview of CMHA Hamilton, including the peer support team and peer support services. Then we'll discuss our peer support research partnership and our project findings, including how peer support impacted the lives of service recipients, what the peer support workers found helpful in their work, and the value of peer support, including challenges and barriers. We'll then discuss some of the next steps for peer support as a valued and integral part of CMHA Hamilton. And then we'll conclude with some reflections on the lessons that we learned about the participatory and community engaged research process. So on the next screen, we have our questions that we would like to ask so that we can understand your knowledge and experience with peer support and what you're hoping to get out of the presentation today. And we'll utilize the chat function for our questions. So we're just hoping to learn, what is your pre-existing knowledge on peer support? And if you can give us a thumbs up if you have experience working with a peer support worker. And then for our third question, we also asked to utilize the chat function to let us know what you want to learn about peer support. So I'll just give everyone a few minutes to answer our questions in the chat, or give us a thumbs up if you have experience working with a peer support worker. So we have Nicole, who has experience with a peer support worker. Mylene. All right, it looks like we have a few people who have experience, and if you just want to let us know as well, that we encourage everyone to utilize the chat function just throughout our presentation if you would like to discuss your thoughts, sharing your reactions, and any questions that you have for us. So we'll go on to the next session, our slide, sorry, and I'll now hand it over to Misty, who will share with us what peer support means in the context of our setting and of this project, because peer support can be defined and look very different across a range of settings.
Yes, hi, good afternoon, everybody. My name is Misty. I am a peer support worker here at the Canadian Mental Health Association in Hamilton. And I just want to discuss a little bit about what peer support means to us. Peer support is an emotional and practical support between two people who share similar experiences, such as a mental health challenge or illness. A peer supporter has lived experience. We've lived through similar experiences as our peers, and we are trained to support and mostly instill hope. Peer support is a core contributor to the recovery process, and those with lived experience do have valuable perspectives because of that experience. So these are just a few words that peer support means to us as we help our peers. So lived experience, confidence, empathy, compassion, transparency, sharing, trust, advocacy, friendship, emotions, support, the big word hope, and connections. And I'd like to pass it back over to Mary Ellen.
Hi, folks, and really the key reason we wanted to show you this slide is because people on the call know that CMHA Hamilton, as CMHAs are nonprofit community mental health agencies who provide recovery-focused programs and services for people of all ages and their families. But what we really want to point out in this particular slide is just that CMHA Hamilton introduced peer support services in 2021. It was identified actually as a gap in core services by our client and family council. So we sought out some money and were able to bring on 4 peer support people. The really key feature, though, going back to what we've sort of already said, is that peer support is embedded within all of our existing programs that we offer here. So anybody from all of our services that you see up here on the slide are able to refer into peer support, and our other staff utilize peer support for their insights, for their thoughts, for their connections, and for general support. So it's really a collaborative effort across the agency.
Okay, and next we have on the screen the CMHA Hamilton peer support team. The lived experiences of the peer support team encompass mental illness, physical illness, trauma and abuse, addictions and substance use, concurrent disorders, involvement with the justice system, probation and parole, homelessness, and experiences of housing insecurity. And the team also has many positive shared experiences, including recovery, self-determination, resiliency, professional and personal development, gratitude, and self-care. And some of the important steps that we learned from the peer support workers included completion of the Mental Health Rights Coalition peer support training program that consists of 30 hours of in-person class learning and a minimum of 50 hours of peer work, mentored practical work. Each peer support worker describes several mentors that influence their idea of what a peer support worker should be, such as senior peers, friends, family, service providers, psychologists, and previous group facilitators. And the team described peer values such as self-determination and authenticity, also all the values that Misty mentioned. We also learned about the recovery principles and the code of conduct as being guiding factors in their role as a peer support worker. The peer support team completed a range of professional development and training initiatives, such as peer support values in action, documentation for peer support workers, which was offered by the Center for Innovation and Peer Support, as well as training in nonviolence crisis interventions, mindfulness, working with marginalized populations, and also committee involvement. And then on the next slide, we have the current peer support services. So these, as Mary Ellen mentioned, the peer support referrals are internal through various services, and the peer-led programs are offered through various modalities to accommodate the needs of target populations and increase access to low barrier services. So the one-to-one peer support service is funded by Health Canada's Substance Use and Addictions Program, also known as SUAP. And these are one-to-one meetings that are pre-arranged at a convenient location, such as a park, a local coffee shop, a home visit, or in the community. And the length of each meeting ranges between 30 minutes to 1 hour. However, some clients do require more than an hour, and the team is able to accommodate if necessary. The meetings are scheduled weekly, bi-weekly, and monthly meetings. Secondly, the drop-in peer support. It's a new program which is funded by Health Canada's Substance Use and Addictions Program. Drop-in is available every Tuesday and Friday from 1 to 4 p.m. And the drop-in space is located at 131 John Street, right across from the GO station in Hamilton. Peers are also involved in 2 group support programs. The first one is the Mood Menders program, which is funded by CMHA. Here, a peer support worker facilitates the program once a month at Williams Cafe at Pier 8, which is located in Hamilton. The second group support program is the Smart Recovery meetings. So Smart Recovery stands for Self-Management and Recovery Training. And these meetings are funded by Health Canada's SUAP program. They are weekly recovery-oriented, structured peer support group meetings that is offered to working age males and transitional age youth over a period of 8 weeks, with sessions lasting between 1 to 2 hours. Peers are also a part of the street team, which is funded by SUAP as well. The street team is composed of 1 registered nurse and peer support workers. The team visits shelters, drop-ins, and encampments across the city to provide mental health, addiction support, nursing care. They distribute naloxone and harm reduction supplies, as well as facilitate connections to primary care physicians, psychiatrists, and addictions medicine specialists. And they also offer continued support to avoid eviction and institutionalization. And then we have the intensive supports pilot that the peers are also involved in, which is a collaborative project with the Canadian Mental Health Association, St. Joe's Hospital, City of Hamilton, and the Coalition of Hamilton Indigenous Leadership. The intensive supports include case management, city housing assistance, and clinical and non-clinical health support to find and maintain supportive housing for individuals who were experiencing chronic homelessness or lived in encampments during the pandemic. So peer support workers are able to assist with access and transition into housing, along with offering continued mental health support, help with referrals to services, and offering those harm reduction support and supplies. And then the SOLGEN, also known as the Mental Health and Addictions Peer Support, or MAPS program, which is funded by the Ministry of the Solicitor General. And here, peer support workers are able to support those on probation and parole. The Second Heart Project is the last project that peers are involved in through McMaster's Department of Family Medicine. And here they provide access to clients who are admitted for infectious endocarditis from injection drug use and transitioning from hospital to home. And peer support workers are able to support them in this transition. Okay, and so now I will go and provide a brief project overview. This research project was funded by MyTax Accelerate, which is a government Canadian nonprofit organization that supports innovation by providing funding for projects that connect post-secondary institutions with industry or nonprofit and public sectors, who then develop projects to meet the needs and aspirations of the host community organization. So our research team worked together on building this research project starting in 2021. Our research team includes students and staff, and we met regularly over the period of approximately 1 year before our proposal was finalized and approved by McMaster's Research Ethics Board. Our study is grounded in the participatory principles of co-learning, mutual benefits, long-term term commitment, and a relationship between academic and community partners. As a team, we created this project and worked together to shape the study's goals, questions, methods, and end products to reach the target population, and as well as to educate community providers and members about recovery-oriented peer support services being offered at CMHA Hamilton. So the overall aim of our study was to investigate the benefits and challenges of peer support from the perspectives of peer support workers and service recipients. Our research questions for peer support workers focused on understanding their perspectives and role within the current program and their impact on peers. For service recipients, we strive to learn about their experiences, both accessing and engaging in peer support, and to understand what is important for service users moving forward. Our study design, again, was both participatory and community engaged, and we recruited participants by email and poster invites, and interviews were completed on Zoom or the phone and in person. We were able to complete 22 semi-structured interviews and completed a reflexive thematic analysis. Our study participants included 4 peer support workers, 1 female and 3 male. 2 peer support workers completed university, 1 obtained a high school diploma, and 1 reported less than high school education. Of the 18 service recipients, 10 identified as female, 7 identified as male, and 1 identified as trans male. 12 recipients described their ethnicity as Caucasian or Canadian, 3 identified as Indigenous, and 3 identified as mixed ethnicity. The employment status consisted of 1 participant who was retired, 2 receiving Ontario Works, and 12 were receiving ODSP, and 3 were employed. So just to provide a quick snapshot of some of the key findings from our qualitative results, our analysis found that service recipients are seeking support in 4 key areas. So the first area is in social support. Service recipients select the form of peer support that they wish to use based on meeting structure and preference. A majority of service recipients preferred one-to-one meetings, and some of the common peer support activities included connecting with day-to-day programs and available resources, referrals, sharing experiences, recreational activities, court support, accompanying appointments, and help with communicating to care providers. The second key area was a connection to addiction support and harm reduction. Many of the service recipients shared. Peer support workers are offering them safe supplies, connecting them with appropriate resources, and supporting their mental health and recovery needs long-term. The third area is in support, they want support is with housing, both in terms of access and transition into supportive housing. And then the fourth key area is employment and income, such as support with seeking employment, support with social assistance application, obtaining identification, and completing taxes, for example. The 4 key areas are consistent with what we learned from peer support workers who describe the form of peer support they serve or they provide as a mix of services, including one-to-one outreach, facilitating group support, drop-in visits, harm reduction, system navigation, housing and employment support, and educating community partners. The overall message that we did learn is peer support is a low barrier service. It's successful in offering flexible recovery-oriented service level modalities to a priority population in the community. Peer support workers engage and inform people who use substances and or experience mental illness about existing harm reduction programs and recovery-oriented services and how to take advantage of them. And peer support matters because it serves an important and underserved target population in Hamilton and accounts for how peer support workers with lived experience can positively influence people who use substances. So our thematic analysis captured the experiences of service recipients accessing and engaging in peer support with really the goal of understanding what is important for service users moving forward. And 6 themes emerged that demonstrate what was important and valued by service recipients. And I will present each theme, and Misty will read the testimonies from service recipients. So the first theme is about empowerment and social relationships. As service recipients valued having someone to talk to and connect with while receiving emotional support. The peer-to-peer relationship was described by service recipients as a natural connection that occurred between two people with similar experiences. And so often engaging in peer support from a position of vulnerability, service recipients explained how peer support workers created common ground, they build rapport, and they make them feel valued. This then led to service recipients reported that they feel worthy, they felt empowered, and this promoted a sense of belonging. And so one service recipient explained how specifically a weekly one-to-one meeting with a peer support worker directly impacted her confidence and mental health. Misty, you're on mute.
Sorry, I was like the perfect segue. I apologize for that. Having somebody to relate to makes me feel worthy of a person and worthwhile, and not like I'm worthless. I feel like I'm actually somebody that's worth spending time with. We're taking the time out of their day to be with.
Okay, and the second theme is about safe recovery environments. And we learned about how service providers feel that entering a safe environment was fundamental to successfully engaging in the service, in their own care and recovery. Service recipients described a safe environment as having this opportunity to interact, learn, and discuss what matters most to them with confidence and without judgment. And an example from one service recipient who described their engagement in a peer-led space had resulted in an increased sense of safety to disclose her true self in a supportive environment.
I didn't really have anyone that I was comfortable talking with. So my peer support worker there was such a relief. Like I could let out a lot of pain and anger that I had inside, and I could be honest with the peer and actually like talk about the kind of more sensitive topics.
And the third theme is about instilling hope and resilience. And it was important for service recipients to receive support in pursuit of their own personal life goals and aspirations. Shared in many stories is how peer support generates hope and positively influences service recipients in a way that helps them to rediscover themselves and take steps towards recovery. So one service recipient who shared their struggles with addiction described how peer support brings together like-minded people, which increases opportunities to cross paths with role models for recovery and is a responsive approach to meeting unique needs and goals.
If you have like an addiction problem, which I do have, they're great support for. And they don't just judge you, like they don't judge what you do. They don't judge you as a person, but they help you by giving you a different outlook in life. Like when you try it like this, or instead trying to quit, you want to come back cold turkey. You try it like this and yeah, make really good suggestions on different things in life.
Okay, and the fourth theme is about reestablishing routine and maintaining balance. And it is about the idea of regaining independence and healthy coping skills and how peer support can help drive this process. And so one participant shared his recovery journey and progress as directly influenced by his peer support worker.
So peer really helped out with those initial steps and, you know, getting back on my feet, getting back into like society. I am pretty stable now since I've been living here. I think I see my workers a lot less because I just do my own thing now. I see them when I need to vent and stuff sometimes. I go like when I need to now. I'm just doing my own thing. Like I go less and need less stuff because I just kind of have a life now. Before I didn't really have much of a life.
And the fifth theme is strength-based guidance, which is about the idea of feeling validated and listened to. Many service recipients explained how peer support created opportunities for them to develop a range of skills and knowledge and learn about their personal strengths and resources that then help them to reconnect with their community.
Peer is really supportive of like me doing better for myself. You know what I mean? Like when I first met Peer, I was definitely not doing good. I was living on the street using, and Peer's just been really supportive of that process, you know. So I'm doing significantly better than what I was. And a lot of it thanks to Peer, you know, Peer pushing me to stay focused.
And the sixth theme is about how peer support can create multiple pathways of recovery influence. All service recipients shared what peer support means to them, most often centering their responses around shared lived experiences. And again, most service recipients were aware of their peer support workers having their own lived experience and wanting to share it with them. And so service recipients really emphasize the sharing of experiences and practical knowledge as an essential component of peer support and their personal recovery.
I've been a drug addict all my life, and I'm still using drugs, but not as much as I was. And I've been housed and my rent's paid on time. And if it wasn't for the peer support workers, I probably wouldn't be able to do that. Like, they keep me off the street, help with my housing, keep clothes on my back, and have food in my fridge and stuff like that. And then they check up on me at least once a week. They make sure I'm doing a-okay.
Okay, and we also want to highlight a few testimonies from service recipients who were involved in the Intensive Support Pilot Project. So the ISP was designed during the onset of the COVID-19 pandemic to support individuals who were experiencing chronic homelessness or who were living in an encampment in Hamilton. And the project resulted in an intersectoral collaborative program that involved peer support workers. And this approach followed a housing first, person first, trauma-informed, harm reduction, and equitable approach to assisting persons scoring high on the VSPDAT in securing and maintaining housing with wraparound supports. The research team interviewed 6 participants who continue to be involved in the ISP program. And all 6 participants reported improved quality of life and self-management skills. And Misty will read 2 of the testimonies for us.
Peer support really helped me get my life back on track. Every aspect of my well-being improved. Without CMHA stepping in and all that, I would have no place to live. Like, they helped me, they stepped in, they found me like this place. I'm really happy about it. I've been here for almost 2 years now, and I'm really happy to be here. Service recipient number 2. There's been quite a few times where my peer support worker helped me pick myself back up and keep going. I just know I wouldn't be where I am today without peer. I would still be on the streets, way worse than when peer found me, and who knows?
Okay, and now we will share what the peer support workers found helpful in their work. So from our interviews with peer support workers, we learned about 5 helpful approaches that peer support workers practice when engaging and supporting service recipients with mental illness and or who use substances. So peer support workers described a strength-based approach to offering practical support and role modeling recovery alongside providing emotional support through this like normalizing relationship approach. So this strength-based approach is helpful to promote autonomy and to help understand what matters most to service recipients, as well as encouraging self-determination and being an advocate at the right time and place. We also learned about a trauma-informed approach to care that was helpful for peer support workers to be responsive to service recipients with complex trauma who may present with a variety of issues and with multiple diagnoses. So peer support workers are able to help service recipients explore connections between various behaviors and presentations and identify early negative experiences or those precipitating factors, and then offer or direct them to appropriate supports when needed. Peer support workers are people who have been successful in the recovery process themselves, and so sharing their knowledge of recovery that stems from that lived experience has also been an effective and helpful tool in their work. And peers demonstrate that their understanding of recovery language and holding an important body of knowledge of the recovery process helps them to offer guidance and increase access to appropriate support, services, and strategies. Culturally safe care, peers emphasize the training they received and the knowledge of priority populations and their needs within the community as important. Peer support workers also stated culturally safe care is about being community driven and responsive to unique needs, history, and systemic barriers of populations, with really a focus on building trust and promoting well-being. And then the last helpful practice that peer support workers described was about maintaining ethics and role boundaries, which is really about peers sharing how they provide support alongside service recipients, not in front or behind, how they have established boundaries when sharing their lived experiences, the ways that they practice a non-clinical role, and express importance of self-care, such as in terms of their own personal mental health, identifying work-related stress and burnout, coping with re-exposure to trauma and addictions, and how to manage that stress, and the importance of accessing support when they need it. And together, these 5 approaches are driving the notion and the shift of seeing the patient in the service to seeing the person in their life and within their communities. So next, we have the value of peer support. We learned that the values of peer support, including recovery, outreach, and role modeling, really stem from lived experiences and learned experiences. These can be transformative in helping service recipients develop the skills they need to take charge of their own lives. And so for stages of recovery, in addition to peer support workers' role in helping breaking down barriers of experience and understanding, it is truly valuable to learn how peers apply their lived knowledge of recovery and learn knowledge pertaining to the stages of recovery when assisting with finding and following service recipients in their own recovery paths. And Misty will read the testimony for stages of recovery.
So I've been through like Suntrack and treatment court and treatment centers myself. So I think I can offer support to people in similar situations, right? Like if they're already at the early stages of recovery, the chances are that they're not going to take the help because where they're at is like they need other people to be able to come and meet them there too.
And for outreach support, we learned the value of peer support workers' role in engaging service recipients who lost trust in services and or lost that motivation to seek support when needed. Misty's going to read the outreach support.
Yeah, sure. So the crowd that I work with, it's like I can kind of need to be able to go and meet them and work on their terms. And once they see like the people caring and trying and stuff, then they sort of open up to try to do different things and come out of their comfort zone sort of thing.
And also driven by lived experience is we learned how peer support workers are positive role models who demonstrate that recovery is possible.
For sure. It's more of on the addiction side of things that I found myself sharing much more largely about than the failures that I have had in and around recovery. I find that I resonate with people a lot. They need to hear that, you know, it's a struggle for everybody, anyone to recover from a drug addiction. And you know, just because I'm a peer support worker doesn't mean it was easy for me. You know, it was easy. It was just as difficult for me as it was for somebody else. And I think that message is really important to hear.
Right. And we also learned about the value of peers' involvement in clinical advocacy and the important role that they can play within care teams.
I have one peer I've been working with since I began here almost 2 years ago. This person suffers from bipolar as well as a few other illnesses. And a big one for us is that we were able to sit down with the doctor virtually after having drawn up a whole slew of questions for the doctor. And my client was able to, with my support, ask the doctor questions. So I should say kind of important, severe anxiety. So they were able to actually ask questions to the doctor on their own, like self-advocate, right? Which was amazing to see because up until that point, we've done a lot of outings in the community together, and you can see that their anxiety was quite crippling. But they needed to self-advocate because medications were not serving them very well and was actually showing far more negative symptomatic issues than positive ones. So that was really good.
And we also learned how peer support workers can support a range of social determinants of health.
The job has since proven to be a lot more kind of community-based and embedded in social needs. So for example, I'm working with one client right now, sourcing food banks and getting food for him on a regular basis. Another one is housing, which is a brutal and hard thing to do at the moment because rents are so high and it's just so hard. It's insane. I'm also working with a guy from the homeless community who needs identification and he has no identification whatsoever, but needs it in order to get to a bank account.
And we also learned how valuable peer support is for peer support workers themselves in sustaining their own recovery.
I am a facilitator for Mood Menders. As much as it is a group that I facilitate, I find I benefit from going. Like I noticed my presence was definitely missed. So I wasn't able to go this last week, but I felt affected by that, right? Like I'm so used to showing up the first Thursday of every month, having lunch with my group, and then carrying on with the rest of my day, where the training kind of put a little, disrupted that consistency and the habitual thing of being somewhere at the same place and the same time regularly. But I do get support through them while they're in that group setting.
Okay, and so we also want to talk about the challenges and barriers that we learned through this research project. And so CMHA is increasingly serving people with addictions versus a traditionally siloed approach where CMHA supports the mental health and another organization does the addictions. And so some of the challenges include the recognition of the role of peer support worker within interdisciplinary teams. Additionally, service requirements and restrictions were also challenges that were encountered by a peer support worker. So for example, lifting restrictions or creating spaces, for example, service animals who are not registered to attend in-person meetings in shelter spaces. We also learned about the challenges of supporting peers to feel safe. For example, when transitioning from living on the streets to supportive housing, we learned about their unique challenges and how peer support workers need to be creative in supporting that transition, such as opening windows to hear street noises or setting up a tent in their apartment. We learned about the professional stigma in terms of other professionals not recognizing the peer role, and also the challenges related to burnout, so managing work-related stress. Barriers encountered by the service recipients included also integrating that peer support worker role within their care pathways, as well as within their clinical care team. We learned about the challenges of peer support not being available in the evening and on the weekend, and also some barriers related to transportation. So some of the service recipients wanting to be accompanied to appointments in the peer support worker's vehicle. And so the recognition of both being able to advance the role of peer support and advance the important role within the care team based on the reports from the service recipients' experiences. People with mental health addictions and involved in the criminal justice system are often referred, unfortunately, to as the hard to reach. And we've learned from service recipients how services are really just not the right services for these people. And this peer support program gives people the ability to engage in their own recovery at their own readiness, at their own pace and comfort level, and how they would like to, which really opens the doors, and that they no longer are difficult to serve, if you will, because there's something available to them that is serving them, and that is peer support. And peer support builds that bridge to a service where they can and want to access. It is an essential role because we have a system that is built to not meet their needs. So we are hoping to advance with research the peer support role within systems to meet the needs of those who are not being met. And I will turn it over to Mary Ellen, who will share with us some of the next steps in future of peer support.
Thanks, folks. I hope you enjoyed the little stories. I just love hearing the words of our peer support workers and our service recipients as well. So you can imagine we really want peer support to keep growing and keep going forward. We're definitely going to be doing that with our recovery college, both through co-design, but also engaging peers to attend recovery college courses and facilitate. We're obviously going to need to increase our sustainable funding for this because we really want to build out their time and maybe get more folks involved because you can see they're so busy and they could do so much more. But that includes then also, making sure that our peers continue with their professional development. Our peers engage with all of our professional development that we offer at CMHA in general, but there's also unique peer professional development that they could and would like to attend to. We want to keep building these community partnerships. We've obviously got a ton going on, but it's so vital just to keep this going, in particular to do things like reducing that stigma of who peer support workers are and what they can do, and really integrate them into that care pathway. We really believe that some of that will happen through those community partnerships. Obviously, we love our research and we're going to keep moving forward on that. We have a few questions. How effective is peer support in reducing recidivism? What impact does the drop-in services have on reducing wait times for intensive case management? We're going to see that fill out as we move through stepped care in the next year or two. So we really want to take a look at that. And then how does peer support facilitate these care pathways for people being released from custody, right? We know that transition from custody to community is really, really fraught with potential difficulties. So how can peer support facilitate that smoother transition? And then last but not least, again, what is that perception of peer support workers as a member of the interdisciplinary care team? How can we build that knowledge of their professional role and their expertise within that lived experience? So really what it comes down to, we also want to really highlight, we want to share a little bit more with you about McMaster University's Faculty of Social Sciences Community Research Platform partnership with us. It definitely advances our work. Our partnership with the CRP has developed CMHA Hamilton's capacity to create and use research to advance our work, providing mental health and addiction supports and services in the community. So the CRP is grounded in knowledge translation, and it moves the research from the lab into the hands of people and organizations who can put it to practical use. So this platform partnership fosters and advances research that ends up being mutually beneficial to both the Faculty of Social Sciences, but also to CMHA Hamilton, because we share research infrastructure in the form of space, software, data, equipment, and of course, expertise. As a healthcare provider, CMHA Hamilton is funded to provide direct quality client services. So research and evaluation are critical to quality improvement in these services. So the CRP facilitates this process to ensure our services evolve and improve based on both quantitative and qualitative data and evidence. So we have a long-term collaboration. Our mandate aligns with the research strengths of the Faculty of Social Sciences, and together we have created this long-term collaborative and trusting relationship. Now, this is very different than most research taking place in the community, which tends to involve those short-term arm's length relationships with researchers invested in primarily studying the population we serve. So that research may or may not be relevant to or advance the work we do directly at CMHA Hamilton. Also, we may never see the results of those one-off research projects. So in contrast, we've built this trusting relationship with the CRP research team. I'll give you a quick example. Our CRP researchers, Rachel being one of them, attended our staff retreat in September simply to learn more about our strategic direction, to engage with our staff and leadership team around effective approaches to research and evaluation for 2 new projects. So the platform partnership supports a culture of openness, trust, respect, growth and innovation, quality improvement, and knowledge translation. We've been a founding member of the CRP since its inception in 2020. And since that time, we've already collaborated on 7 research projects with them, and we have 3 more planned for this fiscal year. Now, in terms of scalability, CMHA Hamilton obviously has strong, we all know this, we have strong local, regional, and national networks, which increases the scalability and impact of our projects. So the opportunity to present our peer support services research here is just one of those examples of how to try to build out that scalability and impact. And last but not least, the CRP recognizes the importance of working across disciplines and faculties in collaboration with communities. Researchers have that unique opportunity through community-engaged research to work with a diverse community to collaboratively address societal issues and to advance the public good. So this includes improving societal well-being and resilience, shedding light on social issues, supporting innovation, and contributing to and/or providing guidance for policy. I don't know, do we have any post-webinar? We didn't get a post-webinar survey up on the Zoom poll either, I think, right, Rachel?
No, we did not.
Okay.
Sorry.
So basically, we just want to thank you. And I will stop sharing and we'll see where the questions are coming from, if there are any.
Thanks so much for the great presentation. Got 2 questions in the chat so far. I encourage anyone who would like to ask a question. You could either put it in the chat. You can use the little raise hand function. Should be somewhere at the bottom there. It's always in a different place on Zoom. But the first question is this a project, any research that's publicly available that organizations and individuals can access?
Rachel, maybe you can answer where people can find it.
Yeah, so we do have a community report that is available on McMaster's Community Research Platform website. If you Google McMaster's Community Research Platform, there should be a link of CMHA Hamilton's research, and you'll find the report there. We also plan on publishing the results in a publication, and we hope to continue presenting our work during these opportunities.
Thanks for the question.
And our second question is, how many people are supported by peer support in Hamilton? And this person said, I work in corrections, and it seems that this program bridges a gap that has historically been there, where many other services cannot or will not provide such practical support for a variety of reasons. Does this or similar program run in other areas of the province?
Yeah, that's a great question, and it's multi-layered. I may have to get you to reread part of it, Katie, but we know that in any given year, CMHA Hamilton sees, I think there's, I don't know the exact number of our population that we serve annually, but I do know that the peer support services themselves touch probably at this point hundreds of people, in part because of our street team and outreach, as well as our different groups that we provide with drop-in, mood menders, and smart recovery. We do have a number of people who are consistently returning to our programs, these group programs. But we often have new folks that we find along the way. So, definitely there's hundreds of people that peer support has touched in terms of both out in the community, but also internally. I would agree. I don't know about, I don't know the answer to, other peer support programs in the city and their numbers. But we definitely are trying to build that out so that we can consistently reach more and more. And then as we move forward into our stepped care model of care, they'll consistently be able to connect with more and more. Hard to give you a hard number on that one. I apologize, but I can certainly try to find that out, and please reach out and we can talk offline in terms of numbers. But suffice it to say that there would be definitely hundreds when you include peer support. Outreach and street teams, along with, Misty ends up going over to different shelters as well and meets folks there. So that's that. Katie, just the last part of that number, I know, or the question, I know that the one part was, you know, it's definitely filling a gap. And what's that last part of the question?
So this person works in corrections. So it's
Yes.
there, as we know, there are, you know, gaps in services that exist for people coming out of corrections. And that's things that we deal with in CMHA Ontario all the time. But just like maybe like speaking to people who are justice involved or things like that.
So other programs in the
Or just how peer support kind of interacts with that.
interacts with the criminal justice system?
Yeah.
Yes, yeah. So a few different ways, certainly. You know, again, through the SolGen, the Ministry of Solicitor General program, we have direct connection to people on probation and parole, of course. There are similar programs of SolGen across the province. I've heard of a few. Again, I couldn't tell you the full extent of it, but I know we were just in contact with, I think it was Sarnia, Misty. I think they have a program, and I know they're out there. Could they be more? Could there be more? Absolutely. We connect also in the criminal justice sector through internal referrals when we have our mental health court support, release from custody. Gray Bruce, yes, thanks, Misty. Release from custody and other court support services then also can refer to courts or to peer support. Now, in terms of how broad our peer support program goes and connects with the criminal justice sector, we're just trying to build that out. We're trying to understand where the biggest need would be. We'd love to see our SolGen program get bigger and also be able to connect to people. We have in our drug and mental health treatment court, for example, we have one of our peer support members who actually attends to the drug and mental health court treatment court afternoon when there's new members, helps connect with them, connects with them the next day, and builds out with the case manager in court support, builds out some of their programming and supports them through that. They might even, in fact, see them while they're doing street teams or outreach. So there's another way that they connect through that drug and mental health treatment court. So I don't know if that answers your question. You can tell that there are still tons of gaps. There's still lots of places for peer support to grow and peer support to be a true, real member of that integrated care, especially transition from custody to community. We're just trying to build those kinds of programs out right now. But that, to me, is a really key transition point where peer support could be invaluable. I hope that helps.
Absolutely, totally agree. You got there's some other, I think maps of the provincial programs written down in the chat there. Any other questions for our presenters? Raising hands, you can also just go on mute. Colleen, go ahead.
Oh, give me 1 second. There. I think we're done. I have it there. Now I've done it. What I found interesting about your research is that you also identified 2 key areas where peer support is currently looking at challenges. One of which is the stigma and the lack of credibility as a profession for peer support. The other of which we're talking an awful lot about these days, peer drift, and being asked to do things when you're part of a multidisciplinary team that are outside of scope of practice. And so I wondered if you could speak a little bit more around those 2 particular pieces in your research, because those definitely caught my attention.
Rachel, do you feel comfortable taking that one?
Can you hear me? Okay. Sorry, I missed your question, but I think you asked about 2 key areas, so stigma and lack of credibility, and I missed the second part. I think you said peer drift.
Peer drift. when you're sitting as part of a multidisciplinary team and being asked to do things that are outside of scope of role as a peer worker?
I'm not sure if we really, did we catch a whole lot of that? I don't know if there was, I mean, certainly, like you say, Colleen, and I hope I pronounced your name right, the research did absolutely identify that stigma and the lack of credibility, you know, to the point where we had a staff member, we had a peer that had a client in the hospital, and the peer support worker was legitimately one of their only supports. And the client said, please, please have my peer support worker come and see me, have him part of the housing, have him part of the transition plan. And when he would call to say, hey, when can I come? They put him off. They didn't get back to him. They, I mean, I don't want to be too, you know, overstating the issue, but they really just didn't see how he could be of support to this client. So it took a lot for us to advocate for our peer support worker to be part of that. In terms of the drift, I don't know, maybe Misty, I don't know if you've seen drift like that in other times, and could speak to it, but I don't think our, you know, it would be a good question for another research possibly, because we didn't see it, but I wonder too, if as we, it's maybe an interesting dilemma, the more peer support becomes part of the interdisciplinary team and these integrated care pathways, could that drift start to happen? And maybe that's something we need to be watchful for.
So in my experience, yes, I kind of there, but it wasn't on the forefront of like the research and the questions. I do believe it was in the slide where future research to explore. So it's something in the future that it might have occurred, but it wasn't a lot while it was occurring. So it was kind of like, yes, it happened. It's a concern, something we can explore down the road. In regards to the drift, boundaries, just creating them, instilling them. I mean, you use your voice for your peers, so use your voice for yourself. If I can really put it in layman's terms. And you know, just straight up, I don't feel comfortable with that. And if people keep pushing, go to your supervisors, your directors, your leads. You know, they're there for a reason. They're there to help you, support you just as much as you're supporting others. Yeah, it's definitely, I think, down the road to explore things like that, specifically your role within the multidisciplinary team and being recognized as a part of the care team and the plan of care for your clients, especially those that are in hospital or incarcerated. And I only say this because some of our projects that we worked on involved us going into the hospital to help deal with their peers before they were, you know, discharged and sent out into the community, to live either the way they were living pre-hospitalization or housed situations. I hope that answers your question. So maybe down the road, maybe reach out to myself or Mary Ellen or Rachel and see if we have a better, more clear answer for you. Maybe it's something that we can observe a little bit more moving forward too, right? So I also raised my hand because I did notice a question prior to the beginning of the presentation that someone was looking for where to go and be trained to become a peer support worker. Peer Support Canada is the only authorized peer support training in Ontario. You can, depending on your city, we have places like the Mental Health Rights Coalition who also can offer training. So it's like 50 some odd hours in class and then like 30 hours out in the community. So it also depends where you live. You might be able to find the program, but Peer Support Canada ultimately is the only one that can authorize your certification as a peer worker. hopefully
And I
that,
think we are, yeah, thanks for catching that, Misty. And I think we are out of time, Katie and Taryn.
Yeah, this questions are pretty great, and I know there's going to be plenty of more questions for you folks. I'm sure there are, but unfortunately we have to cut this short. Please join me in thanking our speakers for their great presentation and for sharing all this knowledge with us. And please take a moment to complete the evaluation that you can find at the bottom of the session page. And again, thank you again for our speakers, and thank you for our audience for joining us today. And please join us at the plenary room for our day 1 closing remarks. I hope you guys have a fantastic rest of the day. Thank you.
Thanks so much.